Good afternoon. Thank you for coming today. It's my pleasure to welcome back two alumni to talk with you today. My name is Erica Ernst. I'm an associate professor in the College of Pharmacy and director of diversity, equity, and inclusion here in the college. And it's my pleasure today to welcome back a couple of alumni. I've asked them just to come and speak with you about their pharmacy journey and their work currently in community service. And Rob, I'm not going to do a lengthy introduction because I'd like for them to share their journey. So Rob Nickel and Shayla Morris. Yes.
Welcome everyone and the folks that are kind of still piling in. My name is Rob Nichols. Can you all hear me all right? You know what? I don't think How about that? Is that a little bit better? Okay. My name is Rob Nichols and I am a pharmacist. This is my alma mater here. I work in Waterloo, Iowa at Greenwood Pharmacy, an independent community pharmacy in Waterloo. That is one of 5 of our family of pharmacies. We have Greenwood, Denver, and Evans Crossing Pharmacy, which are 2 smaller community pharmacies closer, and then another smaller community pharmacy south in Rhinebeck Pharmacy. And then the latest addition is Osterhaus Pharmacy in Makokata, Iowa, to the Greenwood Pharmacy families. And it's been great just to have the Osterhaus family on board with us and learning and sharing ideas with them over the past year or so. I can talk about my journey in pharmacy. Really started in 2009. I was a student at Wartburg College up in Waverly, Iowa. And at that time, or prior to me getting in the pharmacy, I actually went into undergrad planning on being an actuary. So I was calculus was my jam in high school. So that's what I was going to do when I went to college, and that was kind of the career track that I was on. But when I got to college, I really enjoyed the professors themselves, but just the material wasn't really that stimulating to me. And after talking with my advisors, I kind of pivoted to a business management major. But there was a trip that my grandfather had taken myself and my cousin on to Arizona to visit my aunt in Scottsdale, Arizona. And at the time, she was previously an attorney, but she was now a nurse practitioner. She had had a career change herself. And during that trip, she had asked me, so what are you doing in college? Oh, I'm a business major now. And I was, what kind of business management is what I'm doing now. And the question she had for me was, well, what are you going to do with that business management degree? And I was like, I don't know, maybe work for a business, I guess. I had no real good answer for her. And so being in the healthcare field, she had kind of put me on to pharmacy as having growing opportunities at the time, and had advised me to talk with some of my professors when I got back to the school. So granted, this trip was going into my junior year at Wartburg that we were having this conversation. So when I got back and had the conversation with my advisors about what would something like that look like, what is pharmacy, what are the opportunities there, because my I guess idea of what pharmacy is a lot of the ideas that we're trying to change and that we've been trying to change over the past several decades. So I had talked with them and they kind of gave me an idea, and I thought it would be prudent for me to have some practical experience. So I was lucky enough to be connected with a local pharmacist by one of my newer advisors in the science department at Meyer Pharmacy in Waverly. So I started, I was actually had volunteered at Waverly Health Center prior to that, just to get in some initial experience. Then I got a paying job at Meyer Pharmacy. In 2009, went on, started to get my technician certification. And through that time, just in that first year, I was able to see the type of impact that a pharmacist can have on a person's life, from life advice, even beyond, beyond prescriptions, what contracts are in the air, what can I do for my drug insurance if I can't afford my medications, what other options are there if I need to, if I'm not able to afford my medications. I just saw the pharmacist there as such a pillar and a rock for the people in that community. And that's something that I wanted for myself. I was like, hey, this seems a pretty cool thing to pursue. So after a few years of different things, living in a couple places, I had left Meyer because my wife was in grad school in Des Moines. I got asked to come back to Meyer because there were some staffing changes that they needed some help. And so I came back, and the following year I got accepted into Iowa to pursue my PharmD degree. And I was so grateful for all the people throughout that process, for making that decision that I wanted to pursue pharmacy, to actually getting accepted. People that were employed by Iowa in the admissions department were so helpful in helping me understand how to build my resume and build my application for acceptance. So I'm grateful for all those people that were so helpful for there. So when I got to pharmacy school, and I'm kind of thinking tying into service here, it wasn't something that I was heavily involved, like in undergrad. I wasn't really heavily involved in organizations and service. Dean Latender always talks a lot about professionalism, but engagement in the profession, outside of some of the brief things I had with IPA, I hadn't done a whole lot of that. But that was something that was really emphasized here. Service to community was emphasized here at University of Iowa, at the College of Pharmacy. And I remember one specific talk in a leadership class that Bob Osterhaus had spoke to us in. One thing that stuck with me is he said, the best way to get to know your community is by getting engaged with your community. And that's to say the best way to get to know your patients is by meeting them what they are, seeing what's going on in their lives, going to the basketball games, going to the community events, and getting to know the people that you're taking care of, so that it helps you better inform your decisions when you're trying to help them, when you're in the pharmacy. And that really stuck with me, throughout pharmacy school and getting to Waterloo eventually, where through some of these interactions, from the pharmacy standpoint, thinking of legislative day, making those trips, going to community meetings, just showing up to community meetings, really had a really big impact on the people that were putting on the events. Because what I found is, and I kind of got a sense of this in pharmacy school too, volunteers are hard to come by when you're doing nonprofit work, and showing up for people is half the battle. And as I was reflecting on, this talk today, it was actually interesting because one morning I was driving my kids to school, and a song from Mary Poppins came on, and I think it was Chim Chimney. And I was like, oh, Ari, have we watched Mary Poppins? My daughter's name is Ari. Ari, have we watched Mary Poppins? They're like, okay, we'll watch it when we get home on Disney. We'll watch it one day. And so we watched it. She loved the movie. But one song that stuck out to me, that I've watched that movie before, but it didn't really resonate the meaning of that song, but it was Feed the Birds from Mary Poppins. And I was like, man, that song is like hauntingly beautiful and simple. And I was reading up on it, and I think it was Walt Disney's, like, one of his favorite songs. And it speaks to the little things and the little tuppences that can have such an impact. So you can just spend a little bit of time, a little bit of money, a little bit of engagement can have such a big impact on somebody else who's trying to do something. So it just helped bring this thought of service to community and the simplicity of showing up and being present. And I feel like I've carried that into my new position, which is at-large city councilman in Waterloo, showing up for every possible meeting I can, just to, one, hear what the needs of the people of the community are, but then also making sure that they know they are heard and that they can come back to me if they have questions about anything. So that's kind of was my journey through pharmacy and kind of a little bit of what I'm doing now, but happy to take questions after we hear wonderful things from Shayla.
Thanks, Robert. Can everyone hear me as well? Okay, perfect. I was really excited to come here and speak today with Robert because I feel like my journey through pharmacy has come full circle, especially through Iowa. So I started in 2012 and graduated in 2016. And when I started pharmacy school, I didn't know exactly what I wanted to do. I entered pharmacy school because I didn't want to be a doctor. I didn't want to touch people. Teeth were not my thing. And I was a chemistry major in undergrad. So I really wanted to learn more about medicines and how they interacted with the body and how they could help people. But as soon as I started, I realized that it was truly so much more than that. I love educating and I love talking with patients. And so as I was able to do that more throughout my first year in pharmacy school, and especially the summer afterwards when I was working in a community pharmacy in Indianola at Walmart, I realized the impact that pharmacists could truly have. And I loved when patients, just like Robert said, would come to you with their problems and issues, and they would truly understand the advice that you were giving them, and they were so appreciative. And so as I continued into my second year and third year, I said, I want more of that. How can I figure out how to do that all of the time to not only be personally fulfilled, but really feel like I'm making an impact on my community? So I did my community pharmacy residency here from 2016 to 2017. I did that it used to be Shepley Pharmacy, then it was Care Pro, and it's no longer in the pharmacy residency. I think that's when Greenwood entered as well. And it was in a rural town in Mount Vernon. And so the people there, they only had 1 or 2 family clinics in the area, but we were very communicative with them. And so I got to, meet the physicians that worked there, work very closely with patients' care, and they really took the advice and the recommendations that we gave them. And so that solidified, my choices to go eventually into ambulatory care. My first job after residency was actually down in New Orleans. Great place, by the way. Love the food. And I was teaching at Xavier's College of Pharmacy. And I feel like living in New Orleans for about 3.5 years catapulted me into wanting to be more in the DEI space. Obviously, I am a Black woman and I'm from Des Moines, Iowa. And I've lived in the South before, but having a majority of the community, majority of the patients being of ethnic backgrounds, it really shows how much we can impact and teach others about culture, about understanding why a patient may or may not do something, or understand what you're trying to advise when it comes to healthcare. I feel like sometimes it's very easy to get caught up in, well, why didn't the patient just do that? Why aren't they listening, to the advice I'm giving them? Oh, they're not going to do it anyway. It doesn't matter. But actually talking with your patients and understanding these are the little tiny things that you don't get to see in a 15 or 20-minute visit. That's what makes our job as pharmacists so important, not only to the patient, but to other healthcare members as well. So I was teaching there for about 2 years. And then right before the pandemic, so in January 2020, I actually switched my job to Ochsner Health, which is the largest health system in Louisiana. And I was doing digital medicine. Don't know how that worked out. I probably need to go to the casino or something because I ended up working remotely entirely through the pandemic. March 13th, 2020, we went home and we never came back in. But because we were able to remotely monitor patients for hypertension and diabetes, as well as COPD and hyperlipidemia, we were still able to care for those patients when they could not go into their clinics, the hospitals, or they were simply too far out in Louisiana or Mississippi able to get that care. So that was such a great experience for me, even though you're only talking to people on the phone. And truly, I never met any of my patients face to face. I feel like I built such relationships with them. And it was very impactful for me because, they could call me. Oh, sorry, that was Siri. They would call me about some of their issues that they were having, whether it was Mardi Gras season and they, don't want to miss out on all the amazing food that they're going to have with their family, but they know that, they have to kind of take a step back. Or there were, other things in their lives. I remember one patient. She had extremely high blood pressure. She was a smaller woman, but every time I seemed to talk with her, she always seemed so anxious and so upset. And so for the longest, probably about 2 months, I maybe only made one medication change. And then eventually I asked her, have you ever, seen someone for behavioral health or wanting to talk to someone? Because she had recently lost her husband. And it seemed to me that there were other issues going on that was impacting her health care. And so she did end up going. She called me. She said, I told my daughter what you said. And, I think I do need to go talk with someone. And the next time I spoke with her, she said she was feeling immensely better. Her blood pressure had started to come down. She wasn't as anxious because she had gotten on, a CBT therapy regimen as well as an antidepressant. So those are the things to me that really stick out about why it's important to not just look at the medications, but also look at the person that you're treating. So I stayed with Ochsner Digital Medicine through April 2021. In the interim, I was very lucky enough to be able to move back here to Iowa, but was still working remotely. And then I got the opportunity to work at Broadlawns Medical Center, which is where I currently am. So I'm the ambulatory care clinical pharmacy coordinator there. I'm very excited because we're trying to build up a lot of ambulatory care services. I've been staffing in their primary care clinic with hopes that we can get a full-time primary care pharmacist hired within the next few months. We're also starting a meds to beds programs there, as well as working on some medication reconciliation technician roles. I've also tried to get a lot more, again, in the DEI space as far as committees within the hospital. So we just started our DEI advisory council that I'm a part of. And I also worked with a fantastic health coach that works there, Corey Lewis, and we created a health ambassadors program that we did last fall. So that was working with different community, local community members that work at nonprofits and teaching them about, kind of low stakes education about hypertension, diabetes, but how can they recognize those symptoms within patients that they're interacting with day to day, and even teaching them how to use point of care devices. And then at the end, we were able to give them those tools in conjunction with grants from Iowa Total Care, blood pressure monitors, diabetes meters, Sharps containers, so that they could use those in their nonprofit organizations day to day. So that has kind of been my journey so far. I'm really excited about, the things that I've been able to do within the past few years since graduating from Iowa. Just like Rob said, it's such an immensely amazing faculty that works here. And so I know that, my journey in pharmacy definitely would not have been the same if I didn't come to Iowa.
We'd like to make this session as interactive as possible. So if you would like to ask some specific questions of our guests, please enable the microphone on your tables. The black button will turn green and then you can ask your question. We have several participants online and I'm monitoring the chat and I'd be happy to answer those questions. Or if you want to just unmute yourself. I can't see all of the participants yet. But if you put a raised hand, I could also have you speak as well. So if there's any questions from the audience first, please go ahead. We may not be able to have the mics. So if you want to speak up, I can repeat your question or the one of the. Go ahead, Jay, and then someone can repeat your question.
I think the mic maybe work. I touched it and it went from green to red. Now I can get it to go back to blue, green. So I think they may be working. So you both graduated from the preeminent community pharmacy residency program in the country, which is nice to know. Just think you didn't know. But I guess I'm wondering about in what you see as your development and your sort of your ability to, once you got into practice, to maybe have better definition of what you wanted to do. How big do you think your residency experience was in helping you just sort of come to maybe a little bit more form in what you want to do going forward?
I think it helped immensely because it it allowed me, our residency program was built to be very ambulatory care based, and at Greenwood at least, and I know that's the same with all the other sites, it allowed me the flexibility and the freedom and the autonomy to dream big on what I wanted to do. And so for instance, one of the first things that always seemed to be a consistent bane of community pharmacy was that, well, we don't have access to the information, we don't have access to charts. What we can't operate and practice at our highest ability if we don't have all the information. So that was one of the first things I saw that as a deficiency in our pharmacy that I felt that could really elevate everything that we do with a broader access to information. And so as a part of the residency, we all have our residency projects. So mine, with a lot of help from faculty in understanding the history behind transitional care, mine was to help build a transitional care workflow, policies and procedures for Greenwood, which also involved engaging the health systems in the area on what their transitional care process was like and how could we work together to kind of make things meet. And so my first engagement was with a pharmacist at one of the health systems, Wheaton Franciscan at the time, now Mercy One, who had a little bit of a transitional care workflow going where she was trying to give discharge information to pharmacies who would receive it. And I think it was first week of my residency, I got an email about a meeting that was going on. And again, showing up, I was like, oh, I'll log into that and see what's going on. And it was almost like, she was like, I'm trying to communicate with community members to get these out. And I was like, hey, I'll take them, send them, go ahead and fax them to me, and we'll see what I can do with them. Again, with help from faculty, I was able to build together kind of what happens within a transitional care encounter, or what should happen, the things you should cover, from the reconciliation, identifying drug therapy problems, and communicating and educating the patients on the resolving and communicating with providers to get the prescriptions we need, clarify directions, all those kind of things. So we built a relationship with them. Now on the other health system side, it was kind of a dichotomy because the first health system was really good with discharge information. The other health system was really good with getting MedRec when they were coming in, but not so much discharge. So I had kind of approached them as like, hey, is there any way we can improve the discharging information? Can we get some information there? And the idea through at this meeting with the IT people there, we had some really great pharmacist colleagues within that health system at this meeting too. They said, well, why don't we just give them read-only access to Epic here? And I was like, that's great. Yeah, what he said. Yeah. And that was Chris Clayton was the director at that time. And so we kind of started as a pilot operation, and as a part of my residency project, I was evaluating how my interventions were impacting readmission rates, and I kind of tracked that with the patients I encountered. But before that, so after that meeting, the very next day, I think, I called the other ones like, hey, do you have anything like this? Because I knew they used Epic and they used Epic sometimes. And I was like, do you guys have anything like they have? And they're like, yeah, actually, here, talk to these people. And their people were actually in Connecticut because the Mercy Network was like nationwide. But yeah, I talked to them. Now I have read access to both health systems. And so that just was great for my residency, but as the years moved on, I was able to engage my subsequent residents. I was the first resident at Greenwood, and then subsequent residents, I was able to help them engage other providers. So the next year, our resident engaged in transitional care, the skilled nursing facilities, because we recognized that there was a gap. If somebody didn't go from hospital to home, they went to hospital to skilled, it was like they got lost in this gap of skilled care, and we couldn't really track them or keep track of where they were. So created a workflow there. And then there was a behavioral health, behavioral health clinic that wanted to engage and help kind of decrease calls. So we said, hey, how about this thing? We already have this thing with these other two health systems, so it's obviously not a bad deal. And so we were able to engage them. And so then we had access to 3 health systems, one which included behavioral health. And so that just led to a couple other clinics engaging with, more independent clinics, engaging with us in that way. And it's just been able to help us really build the level of care we can offer. So instead of calling and leaving a message and hoping to hear back on what somebody's A1C might be, I can just pop in and say, okay, this is what it is. Then I can come with a recommendation with the information to the patients. Or if I need to know what a PHQ-9 or PHQ-2 was, I can pop in, see that, and then, okay, now I have a more informed decision when I'm talking to the patient about what's going on. So that was.
Before you go, Sheila, I just want to say, Rob, that just shows me that, you don't have to be an expert. Sometimes you just need to raise your hand, and you didn't have to be an IT expert or, transitions to care expert. And that's kind of what we're talking about when we're talking about, community service and getting involved in the community. Is sometimes it's just that little thing. It's just that little seed to feed the birds, So.
Yeah.
I agree with Rob. I think my residency experience was incredibly important for my journey through pharmacy and where I am now. So to start with my project, I used the DRAW tool, or drug adherence workup tool, created by our very own building set, to interview patients and find out barriers to their medication adherence. And by identifying those barriers, working with them to create interventions. So during that process, I really got to work on my patient communication skills, because again, kind of cold calling these people and figuring out what exactly is going on with them, which eventually, now that I'm thinking about it, helped me with my digital medicine role. But then also communicating with the prescriber if there needed to be changes or adjustments to their therapy. As I was doing that, I started to get really interested in the billing side of things, because as pharmacists, we realize that we do a lot of work, but then how do we get paid for those things? Because we don't get the same RVUs or things like other providers. And so that has always consistently been in the back of my mind. So when I was in New Orleans, my practice site while I was teaching at Xavier was at a federally qualified health center. So during that time, that's when I really started to track not only my interventions, but my billing charges and reimbursements. And that has propelled me in this current role, trying to get up different positions at Broadlawn, specifically pharmacist positions and med rec technician positions, justifying that to CFOs, CEOs of why we need pharmacy staff in these roles versus, an MA or a nurse who may do it well, but we all know pharmacists just do it a tiny bit better. And so I think having those experiences not only improved my confidence in talking in different situations, again, whether that's to a patient or a healthcare provider or someone in upper or corporate management, but also gave me the tools to justify the things that I do and present it in a format to where we can get those roles approved and help set the stage for future pharmacy roles.
Both of you are from Iowa. And Shayla, you left and came back, and Rob, you stayed. What about Iowa pharmacy? What is it about Iowa pharmacy that encourages you to stay in your practice?
So I'll start with this one. While I was in New Orleans and I was teaching, I would always brag about how amazing Iowa was. And I feel like, Iowa is technically a flyover state, so not a lot of people tend to think about it. But I would always tell people that Iowa pharmacy truly is incredible because when we're learning as students, our faculty always encourages us to be independent and think about how we would do it as a pharmacist. And so I tried to lead that engagement and that mentality with my students as well. I feel like so many of us here in Iowa truly want to see the profession move forward, and we are active in that role. We don't just say it, we try to do it the best we can. But then we always work together as well. I never felt like I was in competitive situations when I was working with my classmates or in residency, even though with the community pharmacy residency, you're all in a different site. I truly felt like I was supported. And so I think that's one thing that truly sets Iowa pharmacy and University of Iowa pharmacy apart.
Yeah, I think it's just because we're so collaborative and we're so open to engaging others. I mean, we're one of the few states who has a single pharmacy association. That's unique, in the country. So, I mean, I can call up any pharmacist I know and just say, hey, how are you doing this? Especially now that we have the Community Pharmacy Enhanced Services Network, CPS in Iowa, it makes it so easy to just call somebody up, figure out how to do something, or share ideas, and have those interactions just throughout your day, but then also at the scheduled meetings throughout the year. Feel like you just come back. And it's just like going back. It's like a family reunion. You're coming back, at the IPA annual meeting, and you're just coming back to see your family. And it's just so collaborative and engaging and supporting. Dean.
I just want to say on this response, you're just, I'm a student, you're just extraordinary role. Every sense.
Thank you.
They support yourselves, the way you demonstrate humility and professionalism. I just guess. So I only have one question. It's for you, Dr. Nichols. What are you going to run for?
That's a conversation for my wife.
Good answer.
Yeah. Yeah. What other questions do you have? Well,
Rob, I remember when you were a student, you were very active in student organizations. So for the students that are participating, you want to talk about how that helps set you up for success later in life?
oh man. So I feel like the organizations I was involved with, one of them being NCPA, we started it. I think it was my sophomore year we were starting that, or sophomore year that we were starting that. And engagement within professional organizations helps you so much because you get to meet people, not only the people within the College of Pharmacy, but if you are involved, I would heavily encourage you to engage yourself on the regional and national level, because the networking opportunities and the opportunity to share ideas and learn from people who are also very enthusiastic about moving the profession forward across the country are there and just full of knowledge. So, for instance, when I was a student, and one of the opportunities I got was to be on the Student Leadership Council for SLC, for NCPA. It felt like when we got there to DC the first time, we meshed so well. It was like we were in an instant little crew. And then all of the different pharmacy owners and pharmacists that were engaged at that level just wanted to hear what our ideas were, wanted to share ideas. And it was just like this whole opening of the mind of what could be in the world of pharmacy. So if you are enthusiastic about having, the ideal job, when you get out of, get done taking your NACLEX and NPJE, definitely take advantage of engaging on the national level and take advantage of those networking opportunities to meet pharmacists who were in the same position at you at one point and are still as enthusiastic about continuing to drive the profession forward and expanding the opportunities for pharmacists.
Can you use the mic? I'm sorry, Dean. Esther, can you help him?
Are we good?
Go ahead.
Oh, okay, I'll hold it. All right, thank you. You can tell who the dean and who the students are, right? You were both extraordinary leaders within the college. You walked the talk. You commanded respect by virtue of what you did and how you comported yourself, as I mentioned earlier. And I appreciate more than words can convey how the two of you have carried the Hawkeye message on into your professional world. And whether you're in New Orleans or here in the state of Iowa, you're such great ambassadors for our program. As it relates to our culture and as it relates to building the most welcoming environment that we can, now that you reflect back on your time as a student, what can we do better? What is it that we can do as educators and as mentors and preceptors? What is it that we can do to enhance our program to make it even more welcoming, to embrace differences in culture and religion and all the things that make an institution like ours great? What is it that we can do better in your mind?
I would say things like this are great, but also engaging the students that are currently here in those same conversations about what they feel is missing on that level, or what they feel could enhance their learning on that level, would speak volumes to what you want the university, what the College of Pharmacy to be, and it'll help continue to create more ambassadors for people that they will go out and talk to and say, hey, this is what the Iowa College of Pharmacy is doing. They're listening and they are taking action on the things that help make this learning environment the best, regardless of your background.
I agree with that as well. And I also want to say that when you do have those conversations and take actions, always make sure that they're intentional and for a purpose. Dr. Ernst and I have had this conversation previously, and it's very easy to get caught up in DEI or doing things just as a buzzword or for the moment, or, to say, okay, we did this, but how are we making those actions and changes sustainable? And so that it's reflective of a culture shift or forward cultured movement instead of just for right here, right now. And as Robert said, making sure that not only is everyone included in those conversations, but are we actually listening and implementing those changes?
Gary Milovitz here. I'm hiding behind Jay. Following up on Dean Latender's question, you're both familiar or reasonably familiar with our curriculum. What changes would you suggest that we implement in our curriculum to make sure that all people are, equally respected and treated appropriately?
So I'm not as familiar with the newer curriculum since I graduated in 2016. But I do know that I had my health disparities class with Dr. Catney, and that was such a great experience for me. Not only because I was able to take a class with other people in the college that truly wanted to learn more about underserved populations, But because I think it affords everyone an opportunity to step out of their day-to-day and realize again what someone else's barriers, issues, problems, concerns might be. It's very easy for us, you're a student, you're worried about your exams, you're worried about rotations you're going to take, you're worried about passing your boards. But having those opportunities takes you out of that element for a moment and reminds you why you went into the healthcare profession and specifically pharmacy. So having that opportunity, as well as helping to precept the Hakotepec trip during my residency year, it was just such a life-changing experience for me, because we are very privileged and it's hard to remember that or see that sometimes. So having those opportunities to serve the underserved, even if it's just a small capacity, but again, making it consistent and making it intentional, I think is another way for, us Hawkeyes to walk the walk and talk the talk.
On that kind of same note, I think one thing that I struggled with early on after I finished my residency, and some of the things that we were trying to do at the pharmacy around health disparities and social determinants of health, was be effective at finding community resources that could help a certain group of, or help somebody with a certain thing. So engagement with, I don't know if this is engagement with the public health programs, but helping it become kind of second nature for our graduating pharmacists to know that, hey, if somebody's dealing with this, this is how you find out what community organizations can help support them in the area. I feel like I've come more aware of this as I've come on council and more knowledgeable about some of these resources. But when we're thinking about educating students, I think they'll find value in knowing how they can help their people, whether that's based on their ethnicity, based on just their family, their people in their neighborhood, or just their friends. Knowing how it's valuable to know the resources in your community available, or how to find the resources in communities to be able to help people who are experiencing challenges.
Thank you both.
One more thing with that, because that was excellent, tapping into your local resources. So with the Health Ambassadors program that we did, we had nonprofit leaders from, different organizations throughout Des Moines, including one that helped with veterans, one that helped with children, Parks and Rec, which is still a government entity, and the Hispanic population as well. So I think providing some of those local organizational resources to students, and how can we use our healthcare knowledge in those spaces that typically don't have healthcare providers or healthcare access, because again, they're seeing those populations on a day-to-day basis outside of the typical, doctor's visit or healthcare visit. So I think that helps to engage as well.
And if we're thinking on the entrepreneurial side, how could possibly a pharmacist be a creator of a resource that could help in this area? So that is another thing that's beneficial to support as a college. Any other questions? Oh.
You guys, okay. If you guys can go back to pharmacy school, is there anything that you would do more or less of, or change, or if you can go back and repeat pharmacy school?
Study more my P1 year. Yes.
Yeah.
I honestly wouldn't change too much, because I personally feel that during my time at Iowa Pharmacy, I intentionally tried to push myself more in being involved in organizations and reaching out to faculty. Again, there is such a great faculty and staff here, and I just was not used to that in undergrad. I was kind of always the kid, in school and in college that could just do it. So I didn't really need the additional help. But then you get to professional school and you say, oh, this is a completely different beast. I got to change the way that I do some things. So not necessarily change anything, but really just dig into the sense of community that is here and that's available for you, because they really do care. We all want you to succeed. And again, things like that, you sometimes forget it. So just try to remind yourself of that.
Yeah. I probably should have had a little bit less Java House while I was here. I was there so much. But it's so good. So good. Yeah, I'd say take more advantage of the resources, the knowledge base here. I think part of my track really had me focused on community pharmacy, and that was kind of where my path had taken me. But I feel like there may have been more that I could have learned from my health system colleagues. So that'd probably be something I would have taken more advantage of.
My mic is not working bad at once. So you probably have to repeat my question. Give me a test question before we go.
All right.
During the last few years over COVID, I'm sure you haven't embraced technology the way you haven't had to before, as well as your patients.
Mhm.
I was wondering if you could talk a little bit about the challenges that you saw, not so much, maybe some on your side, but also in the patient population.
Yeah.
And, but also, here's the question. What role do you see ChatGPT playing in your profession?
To be honest, I need to get into ChatGPT some more. I need to do my deep rabbit hole dive.
Let me just repeat the question real quick.
Go
So for those online, so Peter Yoy was asking about the use of technology and how they see technology impacting their care, and also from the patient's perspective, how they see technology impacting their patient, and then also about ChatGPT and how that affects what they're doing.
So yeah, as I mentioned, I probably need to dig more into ChatGPT to fully understand the scope and opportunities there. But yeah, I'd say over the past couple of years, we've definitely been able to take advantage of the technology offerings out there to better enhance our appointment-based model at the pharmacy, to better be able to engage with patients, via some integrated texting opportunity. We've really been able to revamp our marketing and our website to kind of display some of the discovery things that we're engaged in with our residency program and with partners within the community, and across the country, some of the research opportunities that we've been able to be involved with. And I really think it's just elevated our presence, to the pharmacy community and to our community in Waterloo.
Since I did work digital medicine for about 2 years, all we did was technology. So please be very kind to your IT people, because I felt like I was a pharmacist, I was an IT person, I was troubleshooting, all of that. But it really opens up so many opportunities, not only to, again, reach patients that may not be able to come into the doctor's office or into the pharmacy, but it allows patients to truly see, while they're doing things in their day-to-day, how that's affecting their health. So with digital medicine, we used blood pressure monitors and glucometers that would Bluetooth and send that data into the EMR. So with Ochsner, we used Epic. Currently at Broadlands, we use Meditech. But we were able to get that integrated into the EMR as well as CGM data as well. So we would use that to call the patient and then manage their therapy that way. I learned a lot about the billing opportunities. So Robert mentioned any entrepreneurs. I think that could be a huge space with remote patient monitoring for pharmacists. And then we're trying to integrate that into Broadlands as well, because again, if we have patients that have many barriers or social determinants of health, whether there's transportation issues, cost issues, and they can't come in, we would still be able to monitor and adjust their therapy. So I think there's a lot of space for that, specifically with CGMs. I was in one day, I helped 2 different older men, and try to get the apps and get everything connected on their phones. So if you're not familiar with things like that, I would definitely say start getting familiar, because they're certainly not going away, but they're such amazing tools that are available for us, especially with a lot of the Medicare changes for CGM coverage. As far as Chat GPT, I'm not in the pure academic space anymore. I don't know if that's a good thing or not good thing for Chat GPT, but
If you use it as your own personal console.
I
or do
think
you there's more risks relying on
I think there,
Yeah.
I mean, there's always risk if we rely too heavily. I mean, I don't want to even get into the NFL analytics things, but I mean, I think there'll definitely be some potential with the use of AI. Again, I feel like I have to educate myself more, and then allow myself to open my mind and see what we could do, and how it can be beneficial to our practice.
yeah, I think there's definitely space. And again, it's an area that's going to continue to grow. I don't know if I watch too many sci-fi movies, but we always just have to learn how to use that responsibly and safely. So
I robot,
That's a
all
great
this brings you
question.
right back down. I robot.
With the diverse patient population, have you noticed any communication barriers? And if so, how have you addressed those?
Mhm. So at Broad Blondes, our patients speak over 40 different languages. So usually I am having at least one non-English speaking patient, if not more than one. So we do have several language lines that we're able to use, and we actually have a fantastic staff of interpreters that we lean on pretty heavily. So making sure that you have not only the initial tools to find out what language your patient speaks, but also if you see that you're having a larger percentage of patients from one particular ethnic background or culture, learn a little bit more about it. I know we do talk about that in school, where some cultures, they look at healthcare providers in a different way. Some patients may be more outspoken, or some patients may bring in their entire family. But once you get settled into your role in your community, really try to learn what exactly is going on, so then you're able to empathize and communicate with your patients more. So, for example, when I was in New Orleans, it doesn't make sense if it's, I know it's the season when you have a ton of crawfish boils to tell a patient to completely cut out salt. They're going to look at me crazy and not answer my phone calls. But learning, different traditions and cultural things that are going on can help you compromise with the patient, and then also still allow them to feel like they're not having to give up everything that makes them them, or everything that brings them joy. And so that's one thing that I've been excited to learn about with the different patients that I have. But I think that's always something that runs in my mind. And I always try to tell patients, I'm not here to tell you you can't. I'm here to work with you to see how you can get better and still do what you need to do on a day-to-day basis.
Yeah. Like Des Moines, Waterloo's a very big refugee community. I'd say probably 3-4 decades ago, lots of Bosnian refugees. We have a lot of Congolese, Sudanese, and now more recently, a lot of Burmese refugees. So the language barrier is there. And I think for us, our county health department was incredible. They have incredible resources, lots of translator resources. But even if you can't, if we weren't able to get a hold of those people at the county health department, I found a lot of benefit in kind of using, the mobile translation tools that we have, like Google Translate has been incredible just for having conversations. And I mean, I'll have an iPad, or I'll have my phone and just hand it back and forth. But then, like Shayla said, again, engaging with those communities to figure out what their traditions are, when things typically happen in their communities throughout the year, just to know how we can be best in as informed as we can and when we're interacting with those patients.
Des Moines gets a lot of refugee populations as well, and we have a provider that's very involved with the local refugee organizations. So that's again something that you can do once you're in your community, going out to those places to learn a little bit more about, what is their process when they first get to the States? Do they have an advocate that's helping them get around, or what resources do they typically need? And it doesn't specifically have to be refugees, but any sort of underserved population that you're interested in or you happen to see comes into your pharmacy or workplace often, reaching out to those local organizations that are already doing a lot of the work, but then bringing that knowledge into how you can help benefit your patients and yourself.
Yeah, and you'd be surprised like how many of those little show up things. I mean, you just show up and that this person is doing this event, but then they also do these 3 other events that are completely unrelated, but maybe your expertise as a pharmacist or something from your background, even if it's not pharmacy related, can have and be able to inform something they may be able to do better, or something that you can learn from them that you may be able to do better. So yeah, getting engaged can have so many offshooting benefits.
Well, I want to thank you both for joining us today. I can hear sounds out in the hallway. I'm pretty certain there's another class ready to come in and take these seats. But thank you all, the audience and those online, for participating with us today. I know I've learned a lot. I hope you have too. And it was great, as the dean said, to see your smiles and to show you the building again. And so thank everyone for coming today, and thank you both for your participation.
Thank you for having us.